Good morning and welcome to today's presentation. I was asked by our principal, Mrs. Kathy Morrison, to propose a strategy that could be implemented into our school and community on an arising issue in the community. Rochdale State High School has a vision for our students. The vision is underpinned by the motto of integrity and achievement. It captures the spirits of our students as they strive to achieve their individual goals. Each individual is encouraged to grow academically, socially, physically, and creatively to contribute to the school community. Our values of success, integrity, and participation, wellness, and equality are promoted by staff, students, and parents. It is in light of our values that we must look at the issues our youth face. The topic of mental health is quite generally placed at the bottom of an adolescent's educational years. Very many times, anxiety orders are referred to by teachers and students as procrastination or laziness. However, 1 in 5 Australians aged 16 to 85 have experienced mental health disorders. The Mental Health Council in 2007 recorded that almost half the population, a staggering 45.5% of Australians, experienced a mental health disorder at some point in their life. Depression and anxiety are the most prevalent mental health disorder experienced by Australians. Around 100,000 young Australians live with depression each year. If that isn't enough to get you worried, mental health disorders and suicide account for 14.2% of Australia's health burden. So what exactly is a mental health condition? The Australian Government Educational Policies and Procedure define mental health conditions as not only the way people feel, but also how they think, behave, and interact with others. Mental health conditions are very common. It is with this that the importance of creating a supportive environment for students becomes an important part of school. The World Health Organization have created a health promoting school framework. This health promotion allows for the development of strategies in schools that will provide a healthy setting for living, learning, and working. The framework focuses on the Ottawa Charter areas that focus on the initiative on creating as well as preventing health problems by calling for actions that enable individuals to care for themselves and for others, make decisions and have control over their life circumstances, and create conditions that are conducive to health. So what is involved in creating a health promoting school? Well, the organization of the school, its ethos and environment, the feel of the school in a holistic scenario, as well as the physical and social environment of the school, the organization of the school, its curriculum, teaching and learning, and lastly, partnerships and services that reflect an impact on the school's operation. These partnerships are formed with stakeholders internally and externally. So, what do we need to do? Rochdale State High School requires a strategy that will educate and empower the students positively. It must create awareness and education on the importance to understand mental health and its impacts on the individual, their friends and family, and the community. The initiative must create a supportive environment for not only students but their families and the aid in reduction of the arising issue of mental health in our youth. A general look at the policy and procedures by the Australian Government states that the responsibility for the social and emotional well-being of a student, and it could be shared amongst the school, that the student and its family and the wider community. The procedure covers 3 areas in the support of the student's social and emotional well-being. It firstly looks at the mental health promotion and illness prevention, providing of supportive environment and curriculum, activities that support of students' social and emotional skills and well-being. It follows that and it looks at the early intervention and where there is reasonable suspicion that the student may have significant social and emotional well-being and mental health difficulty will prevent them from engaging appropriately. It is by this that we must implement a mental health awareness program for the school. The first up to curriculum teaching and learning would be to educate and see how previous schools' government policies and help can impact the school positively. Programs have been developed to help within the curriculum. Are You OK have created a toolbox resource for schools to incorporate into the learning and understanding of mental health. It was in 2009, after the founders had lost a family member to suicide, that they developed the Are You OK? The toolbox focuses on the importance of providing a supportive environment for individuals, especially those who are not mentally well. Here at Rochdale State High School, the implementation of the Mind Matters program could be seen as the most reasonable and the most valuable. Mind Matters is a mental health initiative for secondary schools that aims to improve the mental health and well-being of young people. The framework that it provides has a structured guidance and support, but enables schools to build their mental health strategy to see and to build on their unique circumstances. The framework is built around four fully component keys. The first is a positive community component. The second provides students skills for resilience. The third, for parents and families. And fourth, support for the students experiencing mental health difficulties. To get of these compliance provided by a holistic and comprehensive view of student mental health well-being within the wider school community. Each component is explored through a number of online modules covering different topics. The modules contain animations, videos, interactive tools, and resources that can be printed and used within an individual strategy as well as within group work. The Mind Matters is based on the principle to provide help school promote positive and mental health through the school community and difficulties in students by taking steps to improve relationships and resilience. Promotion prevention in a timely and appropriate way. Promotion and prevention and early intervention are a central tenet of the approach. Looking at the school's organization, ethos, and environment is important to know who the community needs to discuss and implement how this Mind Matter framework can work.
Mind Matters in Minutes. What is mental health? Part 2, Why Schools? School. If you wanted to improve the mental health of an entire population, one of the best places you could start is at school. For one thing, most of us go to school. For 10 years of our lives, we have this one thing in common. So it's a place where you can pretty much catch everyone. High school in particular spans a crucial and often challenging transition into physical and social maturity. It's a time when some young people are vulnerable to stresses and in need of support. Research has shown that protective factors developed in school can help all students, and they can also offset risk factors from elsewhere in a student's life. This means that for some students, school can be a haven. Actions taken in school can have a big impact on a student's well-being, not just in the short term, but over their entire lives. And the effect is not limited to well-being. Mental health is a foundation of school achievement. Positive mental health can translate into good behaviour, good habits, good attendance, positive community, and good grades. If every school were producing students with good mental health, we would see a ripple effect across the entire nation for everyone's benefit. Mind Matters is a framework that helps school staff at every level make this vision possible. It is not a program to turn you into a mental health professional. You already have a job. It's not a set of lesson plans. Instead, Mind Matters is a way of approaching what you already do on a day-to-day basis. From the way you smile at students, to the types of conversations you have in the staff room, to the opportunities you take to empower your students. Using the Mind Matters framework, school staff can take a strategic, targeted approach to mental health and create better outcomes for staff and students alike, within our classes, our schools, and across the nation.
Here, we need to look at the school organization, ethos, and environment to know who is important in the community to meet and discuss and implement how the Mind Matters framework can be put in place. The school would require resource and requirements from the end of both teachers and outside stakeholders. In the internal resources, it is important to create visual awareness of the program and what they feel could be done to implement the program successfully. It is vital to ensure that all teachers are fully aware of the modules and how to use them and the reasons behind each module. Finally, to ensure that all students should have access to technology, including computers, iPads, and other web-use materials, so they are able to access the online component of the framework. It is important to also have visits by health professionals in the mental health awareness area, as well as collaborate with Beyond Blue, the developers of the Mind Matters framework, but most importantly, building awareness for not only the students and the teachers, but the wider community by firstly engaging parents and community members and guardians by having them on board. Ensuring the inclusion of stakeholders would mean holding workshops promoting the wellness program to the use of mental health services, resources, and information. It is vital to look at what is readily available. Information out there, it is provided, and the support services for youth are also provided. Reach Out Australia provides support and services for youth facing mental health problems. The mental health issues, the mind time, and the framework also have a vast amount of resources that are readily available within the modules. How do we implement the program? So firstly, we need to look at an expected timeline for when and how we want certain accomplished goals. Term 1 and 2 would be the initiation process of the implementation. These two terms would consist of holding meetings with the Health and Wellbeing Committee, parent and P&C, and both internal and external bodies. The implementation would also mean getting in touch with the Mind Matters program to begin rolling out the framework, hosting a school community awareness discussion program, as well as a meeting to educate those involved within the proposal with justifications for the need of the program, will help ensure all stakeholders, teachers, and parents are on board. Term 3 and 4. By this stage, the framework should already be heavily ongoing within the school. Holding a meeting during the semester 1 holidays with the Health and Wellbeing Committee will give them the ability to summarize and gather information on the success and the strategy thus far. Monitoring the use of the framework within the school and allowing Term 3 to be a reflection of the program. Reflecting on the program and making notes on the necessary adjustments required to facilitate improvement in the program. So, do we require funding? The answer to that question is no. Under the Australian Government Educational General Provisions Act, programs and frameworks developed for the betterment of student health and well-being are free. The Mind Matters framework is easy to sign up to and provides a startup toolbox for parents and guardians. It also has the 4 components to the establishment and success of the framework and is flexible and adaptable to each individual school. The roles and responsibilities of the Health and Wellbeing Committee, as well as parents and guardians and internal and external stakeholders, are key to ensure the success of the program. The following stakeholders are vital. These include principals, teachers, parents, guardians, health professionals, and the wider community citizens. It teaches that the influence to partake in professional development for the teachers has the ability to create better understanding for the teachers, creating learning and understanding. It is important to have school-based counseling and support services readily available and have the counselors have a relationship with the teachers, the students, and the parents. Like the Success program, we will face barriers. However, these barriers are easily overcome. Some barriers include the lack of knowledge and education on the education program by the teachers, students who are new, who are unfamiliar with the program, and the need to adjust the program to cater for all age groups and learner diversity, as well as uncooperative stakeholders. How the schools hold an important role in intervention and prevention? Well, just as a school holds an important role in the education and growing of any student, the intervention and prevention programs have the ability to intervene and prevent major health issues in students, but also allow the students as well as teachers to build personal skills that allow them to make better health choices, take on a sense of responsibility, and allow for the programs to be integrated into the wider community. It also provides professional development areas for teachers, wider experience for both teachers and facilitators. So what are the benefits of Mind Matters? To date, there are 520 schools participating in the program. The program can better provide learning outcomes, better health and well-being for both students and staff, whilst tackling the issue of mental health early can help reduce the statistics of mental health issues in youth. So, let's become mind aware.